The commonest presentation in relation to the voice is a change in the voice. Hoarseness, a change in the character of the voice, or the voice becoming weak, particularly towards the end of the day, would be the most common reasons for a patient to come to see me. Pain in the voice is rare and is usually related to some form of infection or inflammatory process and commonly follows a cold or upper respiratory tract infection. Change in voice again can happen for many benign reasons, but if it's persistent, the patient requires a full and comprehensive examination, including history to assess for risk factors, including in particular smoking, and professional voice users. If they're an opera singer or they have limited water intake, all these things are relevant in the history to try and put together a picture of what the problem may be. Following that, an assessment in the clinic to include, in particular, an endoscopy of the upper airway is really important, and a stroboscopic assessment of the larynx is also possible in the clinic setting to assess in detail the movement of the vocal folds to look for any underlying problems. Often we find that the cause is functional or structural, which means that it's a problem with the way the voice box is working. Unfortunately, sometimes we find disease processes that affect the lining of the voice box, which can then be treated effectively after that diagnosis has been made.